Hi, it's Pam from Your Nurse Advocate Consulting. I just wanted to take a couple of minutes. We're really focusing on this month coming up in March on, bringing families together to be able to care for their aging loved ones. And one of the things that is really important is being able to follow your aging loved ones, whether it's your parents, your grandparents, through transitions such as hospitalizations or from home to the hospital to the nursing home and then home. Recently, one of our clients was in, she fell, she broke her ankle. She went in the hospital to have surgery to repair that ankle. And throughout that whole thing, I was talking to doctors every day, working with the family every single day because things were getting missed, things were getting dropped. They didn't realize she was on fluid restrictions when she came into the hospital, that she had an issue with low sodium. So we had that to deal with. She also had some mental health issues that they didn't know the medicines. They were changing up all those medicines. It ended up being a disaster. She ended up with pneumonia and on a ventilator in ICU, and they were taking her boot off from her surgery, from the orthopedic surgery. And the orthopedic surgeon says, by all no means, the orders were not to take that boot off. But yet the boot was taken off twice in a week's stay in ICU. The orthopedic doctor had to come up and manipulate her foot twice because she was getting foot drop because they were taking the boot off. So I hate to say this, and I've been an RN for over 40 years, and I have worked with some amazing healthcare professionals. But I'm just saying that gone are the days where we can just go into the hospital and just expect that everybody's going to do what needs to be done. Everybody knows what's going on. And with 12-hour shifts, even with nurses, they're there. You may have a different nurse every couple of days and it's just so much gets lost. And what I guess I want to press upon you in this kind of frank conversation is that what could be most detrimental to making sure that our aging loved ones get the best care that they deserve is just not knowing what we don't know, not knowing what questions to ask, not being able to read between the lines, not knowing what's not being done versus what should be done. And so really want to press upon you, for this month of March, really going to be offering quite a few things for our families just to come together and become an advocate and how to work together as a team and to take turns, share their responsibilities. So we're starting that off with our series of 3 free webinars. You can choose your date, same masterclass, 3 different dates. And we're going to look at 3 different areas during that masterclass to start off March for us. We're going to look at, number 1, the foundation of caregiving. We're going to look at legal and financial essentials. With having legal and financial decisions made ahead of time, that makes it so much easier for the family not to have to make those decisions because all they then need to do is follow the wishes of their aging loved ones. We're going to talk about navigating healthcare and advocating with confidence, just like the story I shared with you. Helping to make sure that we just keep all the balls in the air and all the pieces of the puzzle in place so that, nothing gets missed. And then lastly, we're going to talk about really strengthening family collaboration and communication. How do you bring a family together? How do you avoid conflict? How do you include those people that maybe live long distance? How do you prevent one person feeling like they're carrying all the load? Whether you're an only child or whether you have 6, 7, 8 siblings in your family, we're going to talk about how do you build that family collaboration and improve that communication. So I just encourage everybody, go ahead, pick a date that works best for you. And if you're at all in that sandwich generation, balancing a career, a business, family, aging parents, consider just taking a listen and spending some time with us and just getting a good handle on what's necessary these days to ensure that your aging loved one gets the best care possible. So we will see you at a webinar or masterclass soon. We'll include that link for you to go ahead and choose your date. Take care, and hopefully we will continue to bring you more valuable information as the month comes along. Take care, and we'll see you soon.